And Deputy Pauline Tully.
I just want to welcome the Health Amendment Bill by Deputy Burke as well, and I welcome regulation of this sector. And I would fully support any policy or any legislation which seeks to provide the necessary support to allow older people or people with disabilities to remain living in their own homes. Demand, we know, is due to rise in the coming years. Our population is growing. We've got an older population, and a capacity review which was carried out by the Department of Health estimated a 120% increase in home care provision is going to be needed between 2017 and 2031. And at the moment, I mean, that's not been met. I think there's about 6,000 people on HSE waiting lists because, as you know, not everybody's in a position to be able to pay for home care. In the bill here, you reference an undertaking to carry out an assessment of needs, and I noticed that the needs, listed under 6B, they differ greatly to needs considered when somebody is applying for the carers allowance, for example. And I think the needs listed here should be taken into account when someone is looking for home care hours and wish to stay at home. But unfortunately, when they're applying for the carers allowance, only those at the highest level of care are actually considered when it comes to that. It's quite difficult to actually get the carers allowance. There's also a reference to suitably trained personnel in the document. Now, most home care assistants are supposed to have FETAC level 5 as a minimum qualification. Well, working for the HSE they are anyway. And yet, in the private sector, they're paid less than €10 per hour sometimes, which is less than the minimum wage, because many have to travel maybe up to 40 minutes for what might be a half-hour slot, and they're not paid for the time that they're spent travelling. And in the current circumstance, they're not paid for PPE that they have to buy either. So I think they need to be reimbursed. But as a result of the poor pay and conditions, I mean, turnover of staff is quite high, which is damning both for the carer and the home care recipient as well. Then on the other hand, you have some people without qualifications calling themselves home care assistants, because there's no legal requirement for home care assistants and carers outside of the public sector to have full formal training. And so that leads to gaps in knowledge and practice. And I've heard of carers being thrown into the deep end, which is not fair to them and is not fair to the recipient either. And there's very little continuing or in-service education, and as a lack of government and so on in the private sector. There's no register of home care assistants, which means that the title, as SIPTU has said, is not protected. So that's why people can call themselves a home care assistant if they wish. And it means that if a carer is guilty of abusing a recipient, there's nothing to stop them getting a job elsewhere, because there's no register, so they can't be struck off a register. And many of our private companies, they're driven by profit, and I think there needs to be stronger consideration given to not-for-profit options, because there are some not-for-profit options out there. Currently, the lack of regulation just means that professional home care companies are not held to account by anyone. And people in receipt of home care services are vulnerable, and they need to be supported and protected. And we're behind many of our European counterparts on this. Now, while I welcome regulation as both protecting those home care recipients and hopefully seeing better work and pay and conditions for the employees, I also want to ask that regulation, if it's introduced, should not be overburdensome, as it might have the effect of pushing small providers out. I believe the top 3 home care companies, who between them last year received €110 million from the HSE, are all non-Irish companies. All large companies, all non-Irish companies. So I will be concerned of the high cost involved in regulation could drive out the smaller companies and therefore could drive out competition. Thank you.